At some point, each of us is likely to be affected by stroke, whether personally or through a loved one. On today's episode, we'll talk about the relationship between sleep and stroke. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. So glad you joined me. I wanted to talk today about a topic that I honestly didn't know a whole lot about before I started doing my research. But a friend, her father recently had a stroke. So I wanted to sort of get some information together and just get some educational info out there for everybody with regard to sleep and stroke. There's an interesting reciprocal relationship between sleep and stroke. Sleep disorders can contribute to stroke, and they can also develop post stroke or after stroke. So I wanted to talk a little bit about that today. Now, interestingly, and of course, I like my numbers, so I did go on the cdc.gov website, check them out, to get some idea of how prevalent stroke is in the United States. Get this. Someone in the United States has a stroke every 40 seconds, and every 4 minutes, someone dies of stroke. I had no idea that it was that prevalent. Now, when we say stroke, I want to back up just a little bit just to explain what that is. Now, stroke is when a section of your brain is not receiving the appropriate blood flow that it needs to be able to function. So if that blood flow is cut off, it can cause damage to a part of the brain. And there are several different types of strokes. Two main types are called ischemic stroke and hemorrhagic stroke. Now, the ischemic stroke is the most prevalent of the types of stroke. 87% of the strokes that people have are ischemic. And that just basically means that it's caused by a blood clot. So a blood clot travels into the brain, shuts off a section of the blood flow to the brain, and causes damage as a result. The hemorrhagic stroke are the ones that you have possibly heard about, people having an aneurysm or a brain bleed. This happens when a blood vessel in the brain bursts or leaks, and that section of the brain isn't getting the appropriate nutrition, but also with all of that blood that's pooling there, it's putting extra pressure on the brain, causing damage. Now, a third type of stroke is something that we probably have all heard about. It's called a transient ischemic attack, or a TIA. They're often called mini strokes as well. My father had several of these before he passed, and they can often be a warning sign of a bigger stroke down the road. So they are just as important to treat and to diagnose as any of the other two larger types of strokes. Now, what can be contributing to the prevalence of this happening? There are 5 main causes, and I want you to pay attention to these because we're going to loop back to them here in just a second. There are 5 main causes of stroke: high blood pressure, high cholesterol, smoking, obesity, and diabetes. Now, 1 in 3 adults in the United States has at least one of those conditions. I myself have 3 of those conditions: high blood pressure, obesity, and high cholesterol. So the odds are not in my favor. But these are things that, if you know about them, you can treat them and reduce your likelihood of stroke. Now, how does all of this relate to sleep? Interestingly, sleep disorders, as I mentioned, can both precede and follow a stroke. Now, there's one sleep disorder in particular, our old friend, obstructive sleep apnea, that can contribute to stroke as well. Now, remember those 5 leading causes of stroke: high blood pressure, cholesterol, smoking, obesity, and diabetes. 3 of those are also associated with obstructive sleep apnea: high blood pressure, obesity, and diabetes. So with obstructive sleep apnea, how it's contributing to a likelihood or an increased chance of stroke is that it is putting stress on your entire cardiovascular system, your heart and your lungs. And I always like to point out to people when I'm trying to explain this relationship, I want you to take a second and just hold your breath and notice how your heart starts to slow down just a little bit as you hold your breath. And then when you breathe again, your heart starts to speed back up. That's happening on an involuntary basis to people with untreated sleep apnea throughout the night. So all of this extra stress on the cardiovascular system can lead to cardiovascular disease. It can also lead to high blood pressure. It can lead to obesity because our metabolism is messed up. So it's going to lead to diabetes as well. Our metabolism is affected by all of the stress hormones because our body is under stress when we're sleeping when it shouldn't be. So taking all of that into consideration, some of the heart effects that sleep apnea can have, one of the main ones in particular is a disorder called atrial fibrillation. And that's when two of the chambers at the top of your heart, the atrium, they get out of sync with the regular heartbeat. So they beat independently. And sometimes they can beat a little faster than they're supposed to. And what happens is that the blood flow through the heart isn't as effective or efficient as it could be. So it can lead to blood clots. And these blood clots can then travel through the circulatory system and lead to a stroke. Yours truly was recently diagnosed with atrial fibrillation, so I'm currently being treated with that. And basically that means that my chance of having a stroke is 5 times more likely, simply because of the fact that I have atrial fibrillation. So am I treating my sleep apnea? You bet I am. I'm also working on my blood pressure and the obesity. Yeah, I'm getting there. So that's a hard row. That's a hard row to hoe. But those are things that I can do personally to work on and reduce my chance of stroke as a result of my sleep disorder. Now, I mentioned that sleep disordered breathing can also occur after the stroke. And this is important to understand and to sort of investigate if you or a loved one has had a stroke, simply because it means that it's something that needs to be treated to help recovery. So, for example, 2/3 of stroke survivors develop a sleep disordered breathing, like sleep apnea at night. What's happening, or what can be happening in some of the cases, is that if it wasn't there before, really depends on where in the brain the stroke occurs. Because if the stroke occurs and is affecting the facial nerves, the patient's ability to swallow, for example, then there is a likelihood that that lack of muscle tone in that area of the upper airway can lead to sleep disordered breathing, like obstructive sleep apnea. Also, if the stroke occurs a little further down into the brain, into the brainstem, that can affect what's called central sleep apnea, which is where your brain just simply isn't telling your body to breathe for short periods of time. Both of those types of sleep disordered breathing do cause disruptions in your sleep and keep you from getting the good, deep levels of restorative sleep that you need. As we talked about in the past, the deep stages of sleep is where our body secretes growth hormone, and that's how we do a lot of our recovery. So getting good, consistent sleep post-stroke is going to be very important. Now, how will you know what's going on post-stroke with regard to a sleep disorder without specific testing? Well, one of the main symptoms of stroke is fatigue. And fatigue is typically associated with certain types of sleep disorders, but the fatigue that happens post-stroke in up to 70% of patients may not necessarily be related to a sleep disorder. If you consider what's happening, your brain, the most complex organ in your body, has been under stress, has been broken, basically, so it needs to heal itself. And that requires a lot of energy. Also, if you consider your energy that you would normally put toward simple tasks like eating a meal or going to the restroom. In a patient with stroke that's having to go through physical therapy, you're expending a lot more energy to do those simple tasks. So you're going to be fatigued as a result of that. Also, the anxiety and depression that come with hand in hand post stroke, because you just don't know what's gonna happen. Those can lead to fatigue as well. Fortunately, other than getting a diagnosis from a sleep physician or talking to your primary care doctor, there are some things that you can do to try to help your sleep be a lot more consistent. And we have discussed in the past the role of sleep hygiene in getting a good deep level of sleep at night. So some of the common rules of sleep hygiene may not necessarily be able to be applied post-stroke. For example, a specific sleep time and a specific wake time. Those are always going to be as helpful as possible. Avoiding exercise or rehab late in the day. Usually that needs to be done early in the day. And with any type of exercise like that, if it's done early in the day, it can actually help our nighttime sleep be a lot more consistent. Also avoiding caffeinated beverages, coffee, tea, soft drink, and smoking. Smoke has cigarettes have nicotine, and nicotine is a stimulant. So avoiding those at night, especially late in the evening, is going to be important to help consolidate your nighttime sleep. But it is essential to follow up with your primary care doctor to make sure that your sleep after your stroke is as optimal as possible to get you back on the road to recovery. I hope this has been informative for you. I know it was informative for me because a lot of that information I had not known prior to doing my research for the episode. I do want to give a shout out to my friend Dr. Mohammed Saad. He is the Chief of Pulmonary Critical Care and Sleep Disorders for the University of Louisville Health Organization. He gave me some really good insight into some of the post-stroke effects. So I want to give a shout out to him. And I also want to ask you to send me your comments, send me your criticisms, send me your suggestions for future episodes. You can contact me at j@somnilopod.com. You can also follow me on Facebook, Twitter, and let's see, what else is there? Instagram. I always forget Instagram. But you can follow me on all of those platforms. And please do check out the review section of your podcast service and give me some stars if you feel like I'm worth it. And please give me some reviews as well, because those are helpful for me. And until we talk next time, I hope you're all able to get some good rest. Thanks so much.